This is a great question and a classic forensic scenario. If we have a case where there is a motor vehicle accident, can we determine at autopsy whether or not a cardiac event is what caused it? So when I do the cases like this, the first thing I'm going to ask about is, how damaged was the vehicle? That gives you an idea maybe of how much kinetic energy was involved. And then when I do the case, I look at the body and I determine, are there any injuries which could have produced death by themselves? And that's the first initial question. So let me give you an example of a case where we didn't have a lot of injury and then we found that it was a cardiac cause. Older gentleman driving in a grocery store parking lot. Vehicle loses control, smashes into some parked cars, and when authorities arrive to try to take care of him, it's found that he's unresponsive in the vehicle. He's unable to be revived. He's brought to me for autopsy. I look him over. There's no external injuries that are significant. I open him up and I find that he has a big aortic dissection and the blood is filled into his pleural cavity. So this man was probably actively in dissection and he was out driving and finally it ruptured. And so in that case, we know from the slow nature of the accident, there wasn't enough kinetic energy to cause that aortic rupture, and that it was in fact natural. And he had plenty of factors that go along with spontaneous ruptures, such as hypertension and pretty significant atherosclerosis. Now, in other cases, you might do the autopsy and find that the person has like a 99% occlusion in their left anterior descending artery. Or you can look at the ventricular wall and you can see without a microscope they are having an active myocardial infarction. Both of those situations make it much more likely for you to go into ventricular fibrillation and die. Sometimes it's difficult to prove because sometimes there are people out walking around with 99% occlusions. That doesn't mean they lost consciousness in the vehicle and crashed. Witnesses help in cases such as that. But the short answer is if the injuries are significant enough to cause death and the natural disease is equivocal, that means you look at it and you say, well, they could be walking around and not actively dying. Any witness reports can help you there. You can rule out cardiac cause there. Now, furthermore, sometimes we just find a vehicle crashed on the side of the road and we find that the person does have heart disease, something that could cause an arrhythmia, but we can't prove it. In that case, we will call it blunt force traumatic injuries and an accident because it is the most likely explanation in that case. And although a cardiac event could have caused them to lose control, so could a deer jumping into the road. So could a reckless driver in another lane. So that's why we have to put tons of variables together in these cases to come up with the cause and manner.